I'm managing the process. I'm checking in on our providers. But I think initially up front, the biggest advice I could give is like having provider champions. I think my success with the rollout is that I have provider relationships, and that's I know my providers well, or I like to think I do, and I know what they're looking for. So I can help articulate that to Marvix as our vendor. But as far as like, no one knows better than a provider peer what this is going to be impacting them. So our biggest success at the very beginning of working with you guys was having the piloting phase, like I said, and we had about 7 or 8 provider champions. And I used a variation of I had a couple physicians, I had a couple nurse practitioners, a couple physician assistants, and they all were from different subspecialties. They all charted differently, and that really helped us be able to determine like, is it going to pick up different dialects? Is it going to pick up a fast talker versus a slow talker? Is it going to, how is this going to work, and how is this impacting across the entire organization? Because if I pick one siloed, clinic and it works well there, I can't get the buy-in of my entire organization, right? So having that peer buy-in was really helpful for they're seeing their next door neighbor using this tool, and now they're like, I want to use this tool. They're seeing that Jane is going to get her lunch today, and maybe I'm working through my lunch because I'm using a less effective tool. And so that's kind of where it started as far as like, how are we the heavier lift, right? It was like the pilot, and then it moved into implementation and rollout. And so after the pilot, we started having the discussions of like, what are the checklist items of checking in on the providers and making sure that they've done all their proper training and all that stuff. So I have my own checklist, you guys have your own checklist, and we do often, compare those. And I just want to make sure that my providers are doing everything that they need to do. They're using the tool efficiently. So it's not that you have to do it that way. It's just what we found that works best is making sure that providers are always up to date on what the tool, all the features are, that they're using it as efficiently as possible, that we're kind of comparing against their, peers, like how is this person using it versus this person? Because everyone does ultimately use it a little differently.
Yeah.
And I think that's what makes Marvix really cool is that they have that ability, that you can use it as bare bones as you want to, and it's still going to make you more efficient, or you could use it in the most robust capacity. But now a year later, like I mentioned, I'm really just checking in on my providers, making sure that they know, and we're kind of rolling smooth steam, steam ahead, and it's working really well. But that there is an initial lift for sure.